Few broadcast journalists have reached as many people for as many years and had as much of an impact as our first guest, Lesley Stahl. Ms. Stahl joined CBS News in 1972 when she covered the Watergate scandal and was the CBS White House correspondent during the Carter, Reagan, and most of the George H.W. Bush years. She joined 60 Minutes in 1991. She is an 8-time Emmy Award winner and the author of 2 books, Reporting Live and Becoming Grandma. Lesley contracted COVID-19 in spring last year. Lesley Stahl, welcome to Healthline. It's so great to have you here today.
Thank you. It's a pleasure to be here. Lovely.
Great. So I want to talk a little bit about your experience with COVID. You contracted it very early in the pandemic, and initially it said that you didn't want to insert yourself into the story. What changed your mind?
Well, I waited until I was completely, totally recovered, 100%. And then I wanted very much to thank the people who had taken care of me in the hospital and to thank all the people who were caring for patients, either in hospitals or at home. I just wanted to do that little tribute. So I went public with it. I really wasn't trying to keep it secret. I wasn't working at that, but it kind of was secret. I'm not sure why, but I'm awfully glad that 60 Minutes let me make the personal thank you.
That makes a lot of sense, and we're glad to see you fully recuperated and here today.
Thank you.
And so throughout your career, you have covered many major stories, but what have you learned in the last year of covering COVID-19?
Well, I've learned that our system in the country that we all think is so sort of high level to produce and distribute is kind of woeful. And we kind of have to up our game moving forward, because as you just said, we're still in the middle of the pandemic. This is personal, but I also learned a lot about my daughter, who took care of me and my husband, who has Parkinson's disease and got COVID. She took care of us from Los Angeles. And I mean, took care of us. She got all our health needs taken care of. She ordered food for us. And she got me to the hospital when I needed to go. Although I didn't want to go, I'll tell you the truth. My doctor, who, by the way, had COVID as well at the same time, was yelling at me to go to the hospital. And I just adamantly refused because I didn't want to leave my husband. And finally, my daughter just screamed at me and said, "You're going, and I'm sending an ambulance." And she did. I'm not going to say she saved my life, because I never felt that my life was really threatened. Maybe it was, but I didn't feel it. And so I learned that. And I also learned one other little thing. I learned to say no. I changed a little when I was in the hospital. And I've come out and I've kind of reduced the things that I'm doing outside of my family and my job. I'm doing this, of course, which is outside, but this.
Well, and we're glad that you're doing it. But I think that makes a lot of sense because, you know, throughout this last year, I think a lot of different priorities have come into much starker focus for many people. And so thinking also too, just about the role of the media in covering the pandemic. Obviously, you know, as we've navigated different phases of this last year, there's been conflicting information or confusion just as we learn more about the virus itself, but there's also been a proliferation of disinformation. And what are your thoughts on the role of the media in combating that disinformation, but also building trust with the public at the same time?
Well, I'm going to be really honest with you. Mainstream media, obviously I'm part of it, has seen faith in us, trust in us, going on a downward slide. Obviously, the President Trump, saying we're the enemy of the people didn't help. But I think that sort of fading faith was sliding even before he went into office. We can do our stories, and we have done our stories, and we've done public information campaigns. I don't think that's going to persuade people, I'm sad to say. I think it has to be someone local in people's lives that they trust, preachers, ministers, priests, people who see and interact with people who are skeptical on a daily basis. I'm not sure any nationwide campaign is going to do it on television or even, on Twitter or wherever people are going for their information. Because, you're only going now today online to read about and hear about things you already agree with. So if you're worried about the vaccine, for instance, if you're not wearing your mask, it's going to be difficult to turn you around, even though you need to be turned around.
Yeah, and we see that a lot at Healthline too with our readers where while they definitely go to their doctors and they do their own research, it often, comes back to that community and the people that they trust that they go to for that advice.
Absolutely.
Um,
But
so I wanted to
if they're tuning into Healthline, by definition, it means they trust you.
That's what we hope.
Well, people are not going where they don't agree. So if they're tuning into you, you have an obligation, and I think you have the wherewithal to reach people.
Definitely, and we take it very seriously at Healthline. But I wanted to talk to you also a little bit about mental health, because this has been a huge part of the national conversation throughout the last year as well. And I think in a lot of ways, the pandemic has sort of helped to normalize it. It's helped to kind of destigmatize it because it's touching so many people. And we saw this just recently in Meghan Markle's interview on CBS just this past Sunday, where she opened up very candidly about her own struggles, albeit in a very different context than the pandemic. And what are your thoughts on the role of media as keeping mental health in that conversation, both during the pandemic and when we're far beyond it?
Yeah, I think we have a huge obligation, especially if we can get to young people. Unfortunately, for the kind of widespread audience that I have at 60 Minutes, it's very difficult. You have to go where young people are tuning in, signing on, linking, because the suicides among young people, or the attempted suicides, or the threatening of suicide, is really increasing dramatically, painfully with young people. And they will turn to their sites that they usually go to for help. And again, it comes down to who do they trust? Who can they turn to? There are so many communities now online that young people go to, listen to, are influenced by. And that's where the interventions have to start. It's really difficult because if you're in a position of medical knowledge, you may not be on those sites. You may not know about those sites. So it's incumbent upon all of us to figure out how to get messages through those channels. It's very, you're asking about how to influence. It's very, very difficult today. And each site,
we have to meet people where they are.
You have to figure out where they are. Each site has a smaller audience than, say, broadcasters. We're into what they call narrowcasting, and it's a problem. And it's one reason probably that you are seeing this proliferation of mental health problems where they don't even know where to turn. People in trouble don't know where to turn. I'll tell you, they're not going to turn to their parents. This is sad. And and if they're home isolated because of COVID, the places they can go shrink. So this is a real serious problem in our country. But, you look forward to the day when this is over. Let's go back to school. You can perhaps begin to turn the corner.
Yeah, that's what we all hope. I wanted to talk to you also too. You mentioned your daughter earlier and thinking about your family. In your book, Becoming Grandma, you wrote so lovingly about your connection with family and your two granddaughters. And how have you all stayed connected throughout this, during this time of isolation and physical distancing? And how do you talk to your granddaughters about what's going on in the world?
We stay connected through FaceTime. And I'm so struck by how the technology came around just in time for this crisis. You know, if COVID had happened 2-3 years ago, we wouldn't have had Zoom. We wouldn't be able to do this, certainly. And I wouldn't be able to talk and see my grandchildren regularly the way I do. You know, I've also seen them, to be honest with you. My husband and I both had COVID. We've both been vaccinated. And we've flown on an airplane, feeling very safe, by the way, and seen them in person, not often enough. So we do stay connected, but that's not what the vast majority of grandparents are experiencing. And all I can say to them is use FaceTime, because it does, you know, you have this connection. I'm talking to you right now, and I feel that there's a connection between us, Erin. And I know that my grandchildren are staying involved with me and I with them because I can see them. You know, sometimes we just turn the FaceTime on and we don't even talk. We go about our business and we come back and
just hanging out.
Watch them color. I just sit here and watch them color, or play with each other, 2 little girls. So FaceTime is a godsend. That's all I can say.
Yeah, definitely. And just using whatever we have at our disposal to stay in touch. I love that. And Lesley, you mentioned being vaccinated, which is amazing, but what else is giving you hope right now? And what message do you have for all of our viewers who are tuning in about what to look forward to in the coming year?
Oh, I'm so looking forward to kids going back to school. I think that's number one. I've been worried about this. I don't know why we haven't vaccinated our teachers in that first wave. You know, they did nursing homes in 1A. I don't know if you're all using those terms, but we do in New York. 1A, older people in nursing homes, and obviously nurses and so forth. But teachers should have been in that group. We're only getting to teachers now. It's kind of an outrage. So I'm awfully glad that we're moving across the country to get kids back in school. It's the highest priority. I can't think of anything more important nationwide right now. I have some optimism because in New York, first of all, it was so depressing to see all the restaurants, certainly in my neighborhood, close one by one, go out of business. Stores boarded up, and now already new restaurants are coming in. Stores are opening up, not a lot, but it's like the buds on trees. We're just getting into spring.
Signs of life.
And I know that we're going to come roaring back. I know it. There's no question. It'll take a little more time, but I am extremely positive about where we're heading after what we've been through. And we've all been through it. That's the other thing. The country, we have all been through it. I know we're polarized. We have our differences, but we've lived through this together. And I am even hopeful that will ease the tension. Oh my God, I'm too much. I'm a rosy person. This is silly.
Lesley, Steve Swayze here. Lesley, we love your optimism and your clarity, and thank you for that. As I'm listening to you talk lovingly about your daughter and your husband, you're also talking about resiliency, and that's a theme of today and the theme of our whole past year. And we're interested to know, you broadcast 60 Minutes. The venerable 60 Minutes has been on the air for a long time. You broadcast it from your living room. Tell us how you did that.
Oh, that's so true. Well, I just talked about how technology came around for us to stay in touch with our families. Look at this. Can you see that red thing behind me? I don't know which way to lean. Can you see it? The red thing over there?
Red thing.
Okay, so that is a recording studio, believe it or not, that I had to build myself. What it is towels and pillows in a box. And CBS sent me this very delicate, exquisite microphone. I record, where's my phone? I record on my iPhone. I record my tracks and what I want to say onto this. I record it, and then I email my recording to an editor, and he sews the piece together. Then he sends me a link of what he's done, and we edit back and forth on Zoom. So the miracle of technology has come around right now. We couldn't have done this 1 year ago, to allow us to keep going at 60 minutes and have it look exactly the way it always looked, and sound. The sound that I recorded into my iPhone is broadcast qualities. So yeah, we've been able to keep going. Chug, chug, chug.
I love that. Lesley, thank you again so much for being here with Healthline today. We hope you stay safe and healthy, and it has been just such an honor chatting with you. Look forward to watching your reporting for years to come.
Thank you. Same to all of you. Thank you.